Welcome back everyone to the Skill Station. Today's feature of the month is going to be ECGs, leads, pads, and the monitor. So heads up because this one's going to be shocking. You see what I did there? You see that? Shocking, pads, leads, yeah? All right, let's jump in. We're just gonna go into this hypoglycemia call because I know that there is a 12 lead lab media loaded into this. So as you can see, let me reset my view here. Perfect. Okay, so as you can see here, we are out on the street and we have a patient and they're unresponsive. And let's just start. I know we're gonna do this is gonna be on ECGs, leads, pads, and whatnot, but let's just take a quick moment to assess visually our patient. Now, as you can see, this person looks like they are drooling from their mouth and they are sweating. They're diaphoretic on their neck. That's actually important. This is not just fun graphics to make things just look realistic. It's a part of your paramedic's assessment here, right? So those are the types of things you have to take into consideration, which is really valuable because I happen to know that this is a hypoglycemic patient. Okay, but let's get right on this. So what I first want to do is we're going to cover ECG, leads, pads, monitor. So we're going to go right into monitor, and we're going to do vitals, and I'm going to click ECG. And I'm going to pick which lead I want. We really love lead 2. We throw lead 2 on them, and there we go. I can see my 4 leads, right? White, black, red, and the ground lead right there. If I go to pads, bam, and there's my pads placed in the appropriate position. Now you're not going to see pads in this simulation placed in the sandwich position, but of course that's appropriate if it's a workable area. So there's your pads. We're going to do our 2 lead on. I want to see more on this monitor, right? Because I can see my leads on here. We're getting electrical conductivity, but I don't have numbers on here, right? I'm looking at my monitor. I can grab it and pick it up and hold it. It is definitely much lighter than in real life. I can place it wherever I want. So if the monitor's down here on the bed or on the cot, right? It's too far away for me to read all the numbers. And a lot of people say, well, how do I get it? You know, how do I get to the monitor? And they're pointing at it with their laser beams. You have to actually walk over and pick it up. And the way that you pick it up is you want your handle, what would be your hands to actually touch the graphic, touch that handle or the monitor, and then click the trigger, and now you're holding it. I'm holding down the trigger. So I can just bring it right on up. I'm here assessing, and I want to see my monitor right there, and it's going to float in the air for me, which is really helpful. I want more information on this monitor. So I'm going to go back to my monitor vitals. I'm going to do the ECGs back on 2 lead, good. Vitals, I want my SpO2, I want to see the oxygen saturation, and there it is, pops up with a pleth waveform for me. I want to see my end tidal, why not? We love end tidal, and sure enough, we have an end tidal nasal cannula on there now. Now I'm not delivering oxygen, I haven't selected oxygen yet, but I am measuring his end tidal CO2, and as we can see, it's 47 right now, which is a bit high. I'm going to turn the pulse on. Turning the pulse on gives me this number right here. That is our pulse. And now I can see that this person is not tachycardic or bradycardic. Their oxygen level is just above 90. They're breathing okay, and their end tidal is a little bit high. Great. Let's see what their blood pressure is. We're going to take a blood pressure now. I can also have the blood pressure taken intervals every minute, every 3 minutes, and you're not going to hear the sound of a blood pressure machine going brrrr like you would in the field. You see the blood pressure cuff appear on them in the right spot, and as you can see, the blood pressure shows up here, and if you set it to change in intervals of 1 minute or 3 minutes, this number will change on you. So if you're giving medications and you want to see the trend, you will see the trend if you've set it to take it in an interval, or you can just take the blood pressure right now. Okay? So here's our monitor. Is that everything? Is that all of our options? Oh, look at this. We can do temperature. Almost forgot about that. Super important on our patients. 96.9. This guy needs to be warmed up a little bit. And glucose. This is probably what we're doing. There's the big problem. 36. Okay, so our monitor is giving us a ton of information here. Now, that's what we want just like on a real call. You want to do their complete vitals, you want to get a sugar on everybody, and you want to just know what you're dealing with here. So we know we need to give this guy some sugar to bring him back and probably put a blanket on him. I see that we're outside. It looks like a nice clear day, not particularly hot or cold that we know of. That would have been in the dispatch at the beginning of the call if it were a part of the scenario. Now, let's say we wanted to do a 12 lead on this person just to make sure that what we're dealing with here, we can see that this is a glucose problem. But what if he also has a cardiac problem? All I have is lead 2 here, right? So I actually can't see a STEMI. I know he's not tachycardic or bradycardic, but I can't see anything else that's going on. I might be able to catch a block in here, right? But I can't see some other things. And I'm going to get a standard 12 lead and send this off to the hospital before I transport this person, because maybe they have a history and we can compare the 12 leads, right? So that's what I really want to get, a 12 lead. So what's really great about this platform here is I go back into our monitor, our vitals, ECG. I'm going down to 12 leads now. Bam, lab media, and there's a 12 lead. This is something that you as a practitioner, as an educator, can upload. So you can upload a real ECG that you want to use, and you can change it per the scenario. So this is an actual ECG readout. It's not some computer generated, waveform, which is really awesome, because that means that I can put in this whatever I want. And as you can see, it shows up very large. So in a VR environment, I can actually get in close. I don't have any numbers on here or a guess diagnosis on here like sometimes the monitors spit out. And that's okay, because for education, I should be able to do this. I should be able to glance at this and perform the box method and be able to tell, even without my pulse on the monitor, is this person tachycardic or bradycardic, and what am I looking at? So here's leads 2, 3, AVF. I don't see any elevation of a box or more. V1, 2, 3, 4, 5, 6. We have good R wave progression. T waves look normal. I don't see any blocks, and I don't see any STEMI, ST elevation. Now, what about rate? Well, I should be able to just glance at this as a paramedic and do the box method. So here, look at this little Q wave right here lands on this nice thick box. So let's get down here. And I'm just going to count backwards, because I like finding one that lands on a thick line and going. So the box method, rather, one large box, we got 300, 150, 175. So this is showing me that this guy's pulse is right around 70, 75, right? And I'm going to come up here and bam, 73. We love that. So now we know that as practitioners, as an educator, I have set the appropriate pulse in the system to match the custom ECG lead that I've put in here for my students, and now they have a full patient to assess that you would have just like in the field, where we've put the leads on. We can defibrillate them if we want to. We can pace them. We can put the pads on them, right? And we can really go to town on this patient if we want to, because I have everything that I need. I can read out everything that I need on this patient. I can assess them per their skin. I can treat them, and we can go to work. So really, this is all I wanted to show you guys, was kind of the components of the monitor, the leads, the 12 lead, the lead 2, your ECG, what type of monitor this is and how it looks and how realistic it is to real life, all the readouts that it gives you, and all the options that you have in this system. There's far more to go into with this, but that's just a brief checkup, feature of the month, really cool monitor ECG leads and SpO2, all this really cool fun stuff. All right, guys, that's all for today. We'll see you on the next Skills Station. See you later. Thank you so much for watching another Skills Station video. Please click on the red subscribe button and then click on the bell to get notified when exclusive content drops. Comment below, let us know what you like and dislike, and I cannot wait to see you again in VR. See you on the next one. Just hanging out? Not sure if you're gonna go to the next video? Maybe click on one of these? Huh? Did you hit subscribe yet? You should. We got some good stuff for you.